The AUA Leadership Program is designed for urologists who have demonstrated leadership skills within organized medicine and who wish to further develop these skills to become the AUA leaders of tomorrow. And we are so excited to be celebrating 10 years of the program. Joining us now here in studio is one of the very first graduates of the inaugural year, and we should point out, the only female graduate from that first year, Dr. Kathleen Kaboshi. Pleasure to meet you and have you with us today.
Thank you so much for having me.
Can you believe it's been 10 years?
I cannot, actually. It's a little scary to think that.
Okay, let's go back. What exactly is the AUA Leadership Program?
So the AUA Leadership Program, the AUA is very progressive, and the leadership has been fantastic about forward thinking about sort of identifying the future leaders in the organization, and I think that was the impetus for this program. They designed this program to sort of identify people who would be interested and then give them exposure to what the AUA is all about and all the behind the scenes things that the AUA does. And then give some extra training on how to be a great leader. And then the other thing, of course, is that it really gives exposure to the mentees, to the leadership within the AUA in the sectors of things that they're interested in pursuing.
So you were part of the inaugural program, the only female urologist. How did you even get involved in that program in the beginning?
Honestly, it was a little bit by luck. I can tell you when I see the mentees that are in there these days, I mean, thank goodness I'm not trying to apply right now. There's no way I'd be in there. But it was a little bit by luck that it was a new program and it caught my eye, and I threw my name in the ring, and it was a great experience.
And you've continued to give back to this program that helped you so much. You're now a mentor.
Yes, I am. Which
How'd
just
that come
shows
about?
I feel old now, but it's been great. You know, I was really flattered and excited to be part of the mentor class. I continue to learn from the mentees and the other mentors, and the program has evolved a lot, actually.
Okay.
And it's been fun to watch that.
One of the key tenets of the program is these capstone projects. Can you tell me what a capstone project is, and can we get into what yours was?
Absolutely. So capstone projects are a really nice exercise or a tool through which we can learn how to work together in a group. So the groups are 3 or 4 mentees, 3 or 4 young leaders in the AUA, and they're geographically diverse and gender-wise diverse backgrounds, some specialty diverse. We all come together. What was really interesting is that the AUA asks for proposals. So each of the mentee groups puts together a proposal of a couple of topics that they think would be interesting. And so it's all aligned with the mission of the AUA and the vision of the AUA and things that the AUA wants to tackle. And then you work together. It's a great exercise to learn how to work together to get a project across the finish line efficiently and remotely. So you learn a lot of tools just in doing the project, not even to mention what the project actually is.
And yours was?
Ours was a great project this year. It's a very important topic, I think, is the effect of experiencing surgical complications on the surgeon.
Oh, kind of flipping the switch there a little bit.
Because of course, we're all here to take care of our patients.
Right.
But it is, I think we called it the second victim, or the terminology that's used nowadays is that the surgeon is the second victim or a silent sufferer, because of course, none of us go to work in the morning wanting to do anything less than the best for our patients.
Right.
And you know, if you're a surgeon, it's almost inevitable. In fact, 95% of the people that we surveyed responded that they had had a serious surgical complication. We didn't actually ask them, we didn't define what serious was, but we asked for anybody who had experienced surgical complications, what percent? It was 95%. What are the effects of that on a surgeon? It's devastating. You know, you feel alone, you feel embarrassment, shame, can I do it? You sort of wonder if you'd pick the right specialty. I mean, there was a very broad range of responses from our surveyees, and you know, it was very educational and somewhat therapeutic in a way for us all to talk about it. And I think the AUA is really embarking. There's a course on dealing with complications, because we have to take care of each other also, in addition to, of course, first and foremost, the patient.
Right. Interesting. You know, the survey actually gets me into my next question, because there was also a study that was released not too far back about female patients who are treated by female physicians do tend to have a better outcome. This was not for urologists, but overall. I would just like to get your take on, why is there a greater need for women in leadership roles, to have women in the urology practice? What do you say to that?
I think this is two questions. One is, why do we need women in urology, and why do we need female leadership?
Right.
So why do we need women in urology? Well, half of the world, half of us are women. So I think sometimes, it's not always 100% true, but women like to go to women. I mean, I think some of the, especially when you're talking about urology and leaky bladders and really personal, intimate
female
topics,
issues,
female issues. I think it's nice for them to have that option to go to women. Last year we surpassed I think just over 11% of urologists are females now, which is really super overall. We're very, very happy about it, but
that's
when
still
you look
very
at
low.
It's very low. And when you look at the numbers, it's still the lowest of all subspecialties.
It is.
Of all specialties, even under orthopedics.
Wow.
However, if you look at the incoming class, it's 40 to 50%. I don't know exactly what the number is, but it's really grown tremendously. So I think the younger generation has got the ticket, like they understand, and I think urology has sort of been a well-kept secret. It's a really great specialty, and it's been a really fun career. As far as female leadership, I think it's always nice to have somebody who's kind of been through it before, because it still is male predominant, and I think that's changing quickly, and we're going in the right direction, but it's still nice to have somebody who's been there before. I think there's this, the work-life balance and having kids and all of that stuff, to have somebody who can help you through that journey.
And as you mentioned, the work-life balance and having children, and being able to see a woman who maybe has done all of that and still has gone on to have a very successful urology career is very inspiring. So it's very important.
Well, I've got my mentors and the people who are my inspiration, who I lean on them all the time, and I hope that I think, the Society for Women in Urology has really created this coalition of women who can help each other, and there are a lot of men who come in and support that also. So I think it's going in the right direction.
Good. Okay, final question. How big of a role has the leadership program played in your professional development?
It's been pivotal in many ways. So again, I got into it, I feel like by a little bit of luck and happenstance, but what the AUA embarked upon this program for is to identify people who want to get involved in the AUA and to invest in them. That's actually how it's evolved into really introducing people to what the AUA does, and how we can make a difference. And that involvement has really opened a lot of doors and I've made a lot of friends, and really it's been a great networking. And again, I keep learning every day from the mentees. It sort of keeps me in the loop about what the younger people are thinking. So it's been really fun and educational.
Well, great. Well, congratulations on the last 10 years, and we look forward to seeing what happens over the next decade.
Thank you very much. I really appreciate your including me here.